Good afternoon. Thank you for joining the 2020 Duty's Core Titles Collection Development Tool Overview. This is a joint presentation of Rittenhouse and Doody Enterprises. My name is Nicole Gallo. I'm the Executive Director of Sales and Marketing for Rittenhouse Book Distributors, and I'm joined today by Dan Doody, who is the President and CEO of Doody Enterprises. We'll be co-presenting this webinar today. This is an ongoing presentation of the Rittenhouse Continuing Education Series. We are recording this session. It will be made available via our YouTube channel, and we'll also be sending you a link as part of our follow-up. Just so you know, your audio is muted during the presentation. If you have a question, you can use the question panel. We will reserve some time at the end of the webinar to answer questions. And finally, if you look on your toolbar in the handout section, we have put a few handouts about what we're discussing today, so you don't have to take copious notes. We make that information available for you to grab and download right from the GoToMeeting webinar. So today we're going to introduce and discuss some of Rittenhouse Book Distributors and Doody Enterprises services. We're going to talk a little bit about the information needs of the health science library and what we can do to assist with that. We are going to talk about the new release of DCT and also our integration with Doody services here at Rittenhouse. So the Rittenhouse mission is to provide retailers, libraries, and hospitals with print and electronic books in the fields of medicine, nursing, and allied health. This comes from leading publishers in health sciences, and then all of the services and products that we have that kind of support that distribution of intellectual property. So a lot of what we do, we wrap up in services to make your collection development a little bit easier. And Doody Enterprises, they've been one of our most trusted sources of timely expert reviews of newly published print book and electronic information in health sciences. They provide updates to their services for health science librarians, and it's combined for a customized weekly literature update with emails and content-rich websites. So if you're not familiar with their services, Dan is going to give us an overview of those here shortly. Okay, so just to get us started today, I am launching a poll that we would like you to answer. So on your screen, you should see a poll that is open. And we want to know if you're familiar with DCT, which is Doody's Core Titles and Doody's Core Titles Essentials. Their review service, their star ratings, which one you have used in the past, and if you have taken advantage of using any of those services through Rittenhouse. And of course, if you haven't, this will be good for us to know. So if you can take a second there and open the poll, if you don't see it on your screen, and answer that, this will help to direct us through the webinar. And certainly if you're not familiar, that's what we're here to do today. Another second or so. So we held this webinar yesterday for the academics, and right away here, I see that the hospital medical library is more familiar with Doody's Core Titles and the services that we offer, which is interesting. A couple more seconds here, and I'm going to go ahead and close the poll. We appreciate this feedback. So it's at about 50%. So the information we're going to share today should be helpful to many of you who are not familiar. Okay, so information needs and collection development. We know that in your medical library and in those settings, it's a challenge to ensure the needs of all of your users are met. You oftentimes have practicing physicians, nurses, and you have a lot of other considerations going on, not the least of which right now is pandemics with COVID-19 and everything going on. We've heard from many of you that your role has changed over the past few months. You have expanding residency programs and maybe increased numbers of medical students coming in early into your hospital setting, budgets, reallocation of funds and how you're going to spend those funds and what portion of those funds will go to your intellectual property needs. Of course, space We know the big trend in the hospitals are to reduce oftentimes the space for library or for printed materials, which leads to the use of digital technology and accessing electronic information. Many of you have undergone implementation for your EMR systems, and how you integrate your information there can become a little tricky, and we're aware of that. And then, of course, once you do make purchases, making sure that they are discoverable and integrated. So whether that is integrated into your systems at the hospital or giving 24/7 access to those residents and practicing physicians or patrons, all of these things are on your plate, and we know that. So we have really focused on offering services that give you some ways to make sure that those needs of your users are met while you're having all these other considerations going on in your backyard. So first and foremost, partner with your vendors, making sure that you are taking advantage of all they have to offer. So that's what this webinar is about. A lot of our services at Rittenhouse are free, so we do encourage you to take advantage of them. We have them to make your life easier. Taking advantage of collective wisdom. Between Dan and I won't tell you how many years we have in the industry, but it is a lot. And a lot of your vendor partners have been around for a while. So whether you're new to your position or you've been there for a while, just chatting about some of your challenges can make it a little bit easier. Hopefully together we can find solutions to some of these things that you're facing in your hospital every day. And then understanding the markets that you're servicing, so trends and market growth, and of course, their ever-changing needs. So why Rittenhouse and why duties? Specialized users require specialized content. You probably know that better than most working in your specialized setting, but the delivery of continuing medical education is increasingly more challenging. So many times now, digital access is required. There are new testing formats on the scene. The internal medicine boards are now moving to continuous online recertification versus once every 10 years. So we know this is a trend going on with testing and recertification, and we know that you giving access to that CME information is really important to keep your users up to date and make sure they're able to pass those tests, and they might be needing that information more frequently. So definitely a trend you need to be aware of. If you're not, and if you are, know that there are ways we can work with you to make sure that information is accessed. Your nursing and your nurses and your nursing programs, the AACN and ANA and many other authorities believe that education has a strong impact on the nurse's ability to practice. You probably see that more than ever on the front lines. Your patients deserve the best educated nursing workforce possible, and you can assist with making sure that they have that important content that they need, whether they're precepting, they're on the floor, they're treating patients, wherever they are in their learning and their training. And of course, in health sciences, there's a very considerable overlap between education, research, and clinical applications of information. So being able to dig and weed through all of that is really important. Okay, so that leads us to some of our services. So I'm going to go ahead and turn it over to Dan at this point to talk a little bit about the exciting release of the Duty's Core Titles 2020.
Thank you very much, Nicole, and thank you to all of the hospital librarians for joining the webinar. Doody Enterprises is a company that's devoted to providing information services that collection development librarians need. And we say that we're a company that has products and services that are built by librarians for librarians. We've had a very active library board of advisors assisting us since the very beginning of the company. And we work with librarians, exclusively with librarians in the development of the Duty's Core Titles list every year, which we'll talk about as we move forward. To learn more about Duty's Core Titles, there's a link there to a video tour on our website. And we've just released about a month ago, we've curated a list of about 50 titles that are available that can really help frontline workers working with COVID-19. That list is available from our website here at this link, and you'll see it later on in the presentation that Rittenhouse makes it easily accessible as well. Next, please. So Nicole's asked me to talk about the why and the what behind Doody's Core Titles. And so Doody's Core Titles came to be in January of 2004. For 35 years, the library market had been served by two librarians named Brandon and Hill, who put together a select list of titles that was created and distributed for free. And in 2004, they announced that they were no longer going to do that work. And so librarians and book distributors and aggregators like Rittenhouse and publishers thought, somebody's got to do this list. This list is just too valuable. So we were asked to consider it. We did some research, decided to do so, as long as we could modernize the list. So Brandon and Hill was a list created just by two librarians, and it was done in print. One year they came out with a medical list. The next year they came out with nursing and allied health. We wanted to come out with a list every single year that covered the entire gamut of 120 different specialties, and we involved more than 100 librarians, volunteer librarians, to select the titles. And whereas Brandon and Hill list was distributed for free, we're a for-profit company, and so we needed libraries to be willing to license the list once it was published. It doesn't cost much. It's just $60 a year for the basic version and $160 for the premium version, but nevertheless, that helps us cover our costs. We published the first edition in December of 2004, and we've updated it annually in this year. The 2020 came out in April, and it's our 17th consecutive annual edition. Next slide, please. So how is it put together? There's 180 healthcare professionals involved volunteering to select the titles. We have 74 content specialists and 106 librarian selectors who worked on the 2020 edition. And there's a four-step process. The first step is that the content specialists choose the titles in their specialty areas of interest that they think are core to their knowledge, to the knowledge in their specialty. Then we have up to 3 librarian selectors in each specialty looking over those lists, and they've got the ability to add titles to the list, and they've also got the ability to take titles off the content experts' selections. After they have come up with their final list, then we ask them to go ahead and score each title on the basis of a scoring system from 1 to 3. And they're rating 5 different collection development criteria. The 5 most important criteria that a collection development librarian must weigh in order to select a book. That's what they're rating on a 1 to 3 scale. Once all of the books have been selected and then scored, we ask the librarian selectors to go over the list and their specialties again one more time and select what we consider to be the essential purchase titles. Approximately 25% of the titles on the 2020 list have been further designated as essential purchase titles. Next. Here's a screenshot of the kind of information that is provided at the Doody's Core Titles website. You can see the upper half of the screen here is devoted to bibliographic information. Underneath it is descriptive information from the publisher. If you look over to the right, in the right column, under premium content, you can see there's links out to the expert review. So in this case, you can actually see the review that a healthcare professional wrote. And you can see that it also has 4 stars. And finally, you can see that in the top of the frame, you can see that this book, the electronic version of this book, is offered through the R2 Digital Library, Rittenhouse's R2 Digital Library. Next, please. We have a second service called Doody's Review Service. In fact, this is our flagship service. This is what we've been offering since 1993. We had a goal when we started our company to create a service for medical librarians that was modeled after the Choice Book Review Service that was about 15 years old and available to academic librarians. We wanted to build a valued collection development tool that would allow subscribers to personalize the content that they were receiving and weekly email updates for us. Those subscribers get an email every single Friday, and over the last 12 months, the subscribers to Doody's Review Service open up their newsletter on average 51% of the time. And the people who subscribe to Doody's Review Service, those librarians, they visit the website on average and view 10,500 web pages per month. We talk about the Doody's Review Service as a three-legged stool. It wouldn't exist without these three legs. The first is that we've got more than 100 publishers sending us their newly published books as soon as they're published for us to review. Secondly, we built an extensive reviewer network throughout the academic health sciences community. More than 8,500 people have reviewed books for us, and they're all academically affiliated, and they are expert in their fields in which we're asking them to review the books. And then the third leg is librarians. We wouldn't have a service if librarians didn't find this useful and a vital tool in their collection development. So the Doody's Review Service database features information on more than 190,000 titles from 110 publishers across 140 different health sciences specialties: clinical medicine, basic sciences, nursing, allied health, and other health disciplines. The secret sauce of the Doody's Review Service is we have editorial review group chairs, senior academics in each specialty who serve as the chair for their group, and they help determine who should be reviewing each new book in their specialty area. Next, please. This is a sample a sample screenshot from the Doody's Review Service web page, like the Doody's Core Titles page. The top half of this is bibliographic information. Immediately under the bibliographic information is the review from the reviewer, and the reviewer is identified by name, degree, and affiliation. And again, up at the top of the screen, you can see that this book, the e-version of this book, is available from one of 3 vendors, including the R2 Digital Library. As a subscriber to this, the Doody's Review Service subscriber can click on any one of those links to go up and acquire the e-version of the book. Next, please. Back to you,
Okay.
Nicole.
Yep, it's back to me. So thanks, Dan. A lot of information. As I said, we will have the recording of this if you need to go back and review that again. And it's also available in the handouts from the webinar tool. So a little bit about Rittenhouse and Doody Enterprises. We have been partners since 1993. We have worked together so that we license the Doody's Core Titles, the Doody's Core Title Essentials, and the reviews from Doody's Enterprises. So we license those so that you, as a Rittenhouse customer, can see the original expert review, and you can also look at the designation for Doody's Core Title, and you can see if it's an essential purchase. So we make them available, and I'm going to show you right now where we make that information available to you, our customers. So Rittenhouse.com is our e-commerce site for print books. When you log in, and you need to have your login as a Rittenhouse customer, your username and password, along the left navigation, you will see a link for Doody's Core Titles. Once you hit that link, you will be taken out to a Doody's Core Title page. This page provides information, gives you access to download the latest edition of the Doody's Core Title. So the 2020 edition is there in a link. But more importantly, and we think more useful, is that we provide a service that will enable you to have a customized list of Doody's Core Titles available for purchase based on your purchase history. So if you hit that first link, we take you out to a Doody's Core Title update page. And on this page, you're able to look at any of the 2020 editions that you have purchased or any that you have not yet purchased. You can expand that, take a look at them, add them to your shopping cart. And it's a really nice tool so that you know that your collections are up to date. When you are looking at the product listing, any of our metadata listings on Rittenhouse.com, you can see a few things. I wanted to point out over on the right-hand side, the icons. So we carry over the Doody's Core Title blue icon. Any book that has that is on the DCT list in 2020. And then, of course, the bullseye means that it is an essential selection from the Doody core title list in 2020. So we have that information readily available when you're looking and browsing through content. We also will provide the Doody core title rating. So you can see right there that this is a great book. It's 3 out of 3. We make that available, again, right on the screen for you to view. We also provide access to the star rating. So here is a Doody star rating. Again, you can see over to the right, the blue icon is there. And we also will have a link out if the book is reviewed from the Doody's review service. We have a link out to that review for your use. So you can see the expert review, you can read all about it, and you have access to that right from Rittenhouse.com. It pops up this additional screen, but you will not lose your session on Rittenhouse.com. Okay, so that was a little bit about print. As Dan mentioned earlier and showed you how you can link out from his review service to the R2 Digital Library. The R2 Digital Library is our website for our eBooks. So if you're on the platform, you have access to these tools right now. If you're trialing or thinking about it, a few things I want to point out about our integration with Doody Enterprises. So as Dan mentioned earlier in his presentation, they have put together a list of 45 essential resources for COVID-19. Several of those are available on the R2 Digital Library. So we have curated a Doody's review service COVID-19 book list, and you can access that right from the filter options on R2. If you look down towards the bottom of the filter, you can also filter all of the ebooks that we have available by DCT or DCT Essentials. So if you are really looking at starting a collection or you're not sure where to start with a collection, using the Doody's core titles designation is a great way because you know that those are the essential books that you need to have a core collection in health sciences. So here's a quick shot of our COVID-19 ebooks. You hit that link. They display right in the screen, and you can see, you can scroll through and look at all the books in that list. You can see at the top, we tell you that this is only the Doody's Review Service COVID-19 book list. So we make it quick and easy. For continuing medical education, it's really important, again, that you're looking at those essential titles. And here we have curated a list of DCT essentials. You can further sort and filter this by area or specialty or discipline just by using the sort and filter tool. But again, you can see right on the screen that it's a Doody's core title and it's an essential title this year. And you have those available, and you can curate quickly and easily a list of ebooks that might be important for you to have on hand in the hospital. New to the R2 Digital Library, we have a fantastic collection of 5-star reviewed titles on the R2 Digital Library. So we have 95 of those 5-star reviewed titles, and we've curated a list right there. So again, there's 95 in nursing, I should say. These are the best of the best. Again, 5 stars, so you can scroll through and look at those quickly and easily on the R2 Digital Library as well. We do show the star rating, just like we do in print. So I've circled it there on the screen. You also have the ability to pop out the review if you're looking and browsing and you want to know more about that title. So because we are licensing this information from Doody Enterprises, we bring it to you here within the R2 Digital Library. Okay, so to use any of those services or tools, you just need your logins for Rittenhouse.com or R2Library.com. And we are happy to work with you to show you some of those tools. Just get in touch if you need your logins. I do have a hot tip here. With the R2 Digital Library, you have the ability to create a Doody's Core Title 2020 patron-driven acquisition collection. What that means is you can open all of those titles on a patron-driven acquisition collection, no initial cost. And that is one way that you can let the experts with the DCT and the evidence from usage on your PDA inform your collection management. So right now, this time of the year with the new list out, we tend to see a lot of people starting those types of collections, and we're happy to do that with you. So quickly, I'm going to turn it over to Dan to talk about how you can get involved. Duties is always looking for volunteers.
So thanks, Nicole. Yeah, there's two ways to get involved. One is as a librarian selector for Duty's core titles. The other as a guest author or guest reviewer for one of our newsletters. In the next few slides, I'll describe each of those volunteer opportunities. We're going to take a case study for librarian selector. So we have 3 different librarians spread out throughout the country or throughout the continent who selected the books in neurology for DCT 2020. And if we go to the next slide, we're going to kind of drill down to Shelley McKibben, who's from Dalhousie in Nova Scotia. And she not only was the librarian selector in neurology, but she was also the librarian selector working with other librarians in 4 other specialties, as indicated on the slide. Next slide, please. So our other volunteer opportunities are to write articles. We have an article featured every single month in Duty's core titles, written by a librarian, typically on a collection development or issue of general library management. In Duty's Collection Development Monthly, we have 2 kinds of authors. One is a guest reviewer of a major electronic resource that we feature every single month. The other is a guest author who would describe the successful launch of a new product or service throughout their institution. So all of those authors, we basically publish 3 articles a month that are contributed by librarians. If you want to volunteer for either of those things, in the middle button there, you reach out to Claire Connor, who's our managing editor. For those of you who've worked with us in the past, the name Ann Hennessy might be familiar to you. She's been our editor-in-chief for all 28 years of our company. She's retiring this year, towards the end of the year, and Claire has assumed Ann's responsibilities.
Okay, and I can say our 2 library has been reviewed before, so it definitely is a useful service. If anyone has any questions, you can enter those on your toolbar. Dan, we have a quick question for you before you jump off. Someone's asking how the pandemic affected the work on the DCT this year, and how did you get it out in time, considering?
Well, thank you very much for that question. Yeah, the pandemic obviously has disrupted everybody's lives. As I said, we had 106 librarian selectors working on Duty's core titles. The work began in late January and it goes until early April. And by mid-March, when the real deadlines were coming down for final selection of titles, final scoring of the titles, and then selecting the essential purchase titles, that's when the shelter-in-place orders throughout many states started being invoked. And it was quite disruptive to those individuals, but to their credit, nobody missed a deadline, and it enabled us to publish Duty's Core Titles 2020 for the 17th year in a row on the scheduled publication date. So thank you for that question.
Yeah, that's awesome. That's incredible. Okay, a question for Rittenhouse about DCT and PDA. What is the cost, and is there a purchase requirement with that? And to answer that question, there is no initial cost to start a patron-driven acquisition collection. So when you add those titles to your PDA collection, they become available for your patrons to use 3 times. And on that 3rd use, they move to a shopping cart, but it's mediated. So you determine the purchase. So if you have a set budget, you can work within that budget, but there is no required purchase with PDA. If you have PDA for a year and you haven't purchased anything, we will assess you the maintenance fee for being active and on the platform. But it's really up to you what you purchase. So there is no initial cost with that. Okay, any other questions? We will be sharing this webinar, and certainly if you have any questions after this, or you'd like to get started with any of these services, either directly with Duties or with Rittenhouse, just reach out to us and let us know. Okay, thank you for joining today. Please stay safe and healthy during this pandemic, and we'll look forward to continuing to work with all of you. Have a great day.